you're saying one person's body might clear it more quickly than the other, for example.
Yeah. Yeah, or metabolize it from that THC compound to another compound, which is, for example, the 11-hydroxy THC compound, which is also an active drug.
Mm.
It's a partial agonist at the CB1 receptor, just like the parent. And women make more of the 11-hydroxy THC compared to men. And so when it comes to edibles, not only might they have differential effects from the parent, but because they make more of the 11-hydroxy THC, which is a longer lasting metabolite in the body, that effect may last even longer, especially with an edible that goes through significant first pass effect, goes through the liver, and a lot of it gets metabolized.
I see. So when it comes to 11-hydroxy THC, the metabolite of THC, how much of it is inside of someone depends on how they consumed it, whether they ate the THC versus, inhaled it, and whether they're male or female.
Yeah. Yeah. And so those are important factors. But then there are additional layers to it as well. In women, we know of the telescoping effect. And so while they might not use as much, they end up progressing through the stages of the addiction cycle faster than men.
Mm-hmm.
In addition to that, we know that there are differences in how quickly men develop tolerance to the effects of THC, which is a very important part of THC of cannabis and THC action that we maybe don't see as much with other drugs. And so the tolerance, the women become more tolerant to THC faster than men do, for example. And so it's at multiple layers, and it's again important. And so even the studies which then give THC to male and female rodents, or like they will just give the same dose to both sexes, and then say, oh, males are more likely to have schizophrenia. Well, they were processed very differently, and they did very different things. And I think that's why it's really important to be considerate of the multiple places that each of these compounds can be had.